So I want to talk about the thyroid today. I know I've talked about it before, but just a little bit of a different take on it. I've seen a lot of people come in recently saying, yeah, my thyroid numbers have been tested and I'm fine, but I don't feel fine, right? So there's got to be something going on. Some of the symptoms associated with low thyroid, inability to lose weight, extreme fatigue not helped by sleep, feeling cold, infertility, thinning hair, hair loss in general, and often you'll find the outer third of the eyebrow start to disappear, if not the whole eyebrow. So that's a big one. Constipation can be related to low thyroid function. And really what we're talking about, thyroid sits right here. It's an endocrine gland, endocrine secreting gland, and it's really controlled by the brain, the hypothalamus and the pituitary up in the brain. So the levels that are mainly tested are TSH, thyroid stimulating hormone, and T4, which is the inactive form of thyroid hormone. What's really important is T3, and so we want to measure total T3 and free T3 in the blood, because that's, like I say, that's the active form of the hormone. But going back to T4, T4 stands for the 4-iodine molecules. And so what happens when T4 becomes T3, which happens in the liver, an iodine molecule gets cleaved off, and then the T3 fits into the receptor and turns the key. So it's the T4, T3 really stand for the iodine molecules attached. So TSH, thyroid stimulating hormone, is made in response to T4. If there's enough T4, the body will, or the brain, the pituitary will stop making T3 because it senses there's enough T4. But if your T4 is low, which is what a lot of people are on levothyroxine for, because their TSH is high because it's trying to kick out thyroid stimulating hormone to make more T4, and so that's that negative feedback loop there. So once the levels of TSH come down, levels of T4 even out, then levothyroxine has done its job, and supposedly, your thyroid is fine. Really not the case. We want to dive a little deeper into the T3 piece. So I make sure and measure the T3, total T3, free T3, and the thyroid peroxidase antibodies and the thyroglobulin antibodies, because those look at autoimmune function, whether or not your body is producing antibodies against itself, against the thyroid, because it doesn't recognize its own tissues. So, which again, we can have a positive effect and help that situation. Some of the nutrients you want to really pay attention to for thyroid health: selenium, iodine, tyrosine. So just a little bit more information on the thyroid and looking at some different numbers and just using the numbers as a guide. I mean, I like to have a complete picture, but I'm really concerned about the patient and how the patient is feeling. I'm not letting the numbers guide me. I'm going back and forth and trying to find a good balance between how the patient's feeling, what the numbers show, and how we might affect that. So just a little bit about thyroid health today.